Welcome back. We're on the final stretch of Talk to Doc, and it's time to take some questions.
Is there a difference in the outcome of surgery between men and women?
Actually, it's the same. There's really no difference. So it really depends on the individual patient. If they are disciplined enough, whether they're male or female, they will lose. They will definitely lose.
Diba, gumastos ka na rin, tapos you went through the whole procedure. Dapat naman maging disciplinado ka na.
You have to be disciplined. If you don't have the discipline, you will not.
Sayang eh. Next question.
Hi, Doc. Will the patient experience significant pain after the surgery? And how long is the patient will stay in the hospital?
Okay, for the laparoscopic gastric banding, well, both gastric banding and sleeve gastrectomy, they're both done laparoscopically, which means we make only small incisions on the belly. This is done under general anesthesia. Most patients will experience minimal pain after the surgery. For the gastric banding, we send them home the following day. They can go home the following day. For sleeve gastrectomy, we can send them home anywhere from 2 to 3 days after the operation. But most of these patients, within the day, they're up and about, standing, walking around. And but the diet is the one that is critical here. The diet has to be small in volume and liquids in the beginning. So for the first few weeks, we only require them to take in liquids.
Downtime is very minimal pala, no?
Very minimal. Most patients get to go back to their regular activities in 2 weeks, 10 to 14 days basically.
Okay, next question.
How big or how heavy a person is to consider having a bariatric or lap banding? Okay,
most patients, we calculate it using the BMI, no? I mentioned earlier, 35 and above. In terms of weight, that's approximately 80 to 100 pounds over their ideal weight. So if you are, say, 150 pounds over your ideal weight, definitely you are a candidate.
Next question.
Hi, Doc.
Yes.
Can bariatric surgery be used for patients who are not obese but have hypertension or diabetes?
Yes, actually, there are more and more patients undergoing bariatric surgery for low obesity levels or low BMI levels, below 35, but then they have concomitant or they have diabetes, they have hypertension, sleep apnea. When all of these are present and their BMIs are not very high, their excess weight is not that high, we can offer it to them, assuming that medication is not really effective. In fact, some patients who undergo bariatric surgery with these medical problems, their condition actually resolves, may improve or in fact completely resolve.
Any more questions?
Doc, at what point is bariatric surgery considered successful?
Okay. I mentioned earlier about excess weight. Excess weight. So the excess weight is the amount that the amount beyond your ideal. So if you are, say, your ideal weight is 120 and your weight is 220, then that means your excess weight is 100 pounds. Okay. Bariatric surgery is considered successful if at the end of 1 year you've lost 50% of that excess weight. So if your excess weight is 200, for example, 200 pounds, and at the end of 1 year you've lost 100 pounds, then that's considered successful already. Of course, that has to be maintained. You may lose the
long term.
You may lose all that weight in 1 year, but then you regain it.
Ay, naku, sayang.
Useless.
There are some patients like that, right?
There are, yes.
Si Ian Ramos emailed us this question: how do you deal with excess skin after attaining the ideal weight loss? Okay,
most patients who reach their goal or their ideal weight, which is usually in the range of around 18 to 24 months or a little bit more after the surgery, we have them referred to a plastic or aesthetic surgeon. So because we expect a lot of what we call butt winging under the arms, the aproning here. So the excess skin sometimes may even reach up to the knees. And the inner thighs. These are the areas where excess skin usually is seen. And when they have maximized their weight loss, then we refer them to an aesthetic or plastic surgeon.
Kasi problema pag bumalik na naman, nag-weight gain na naman, tapos wala ng skin. Paano yun? Delikado. Any parting words for our viewers, Doc?
This type of condition is actually a lifestyle problem. So before you even reach the point of requiring bariatric surgery, we recommend that everyone maintains a healthy lifestyle. You take the proper foods, you exercise regularly. However, if it comes to a point that you really cannot reverse your weight anymore, then bariatric surgery is an option. It is the last option, but it is already available here in the Philippines. And if that point comes when you need to undergo the surgery, you can always reach us at the medical city.
Ayan. Thank you very much, Dr. Salud, for sharing your expertise with us.
Thank you. You're welcome.
And of course, thank you to all our
Yeah.
audience. Thank you for asking your questions and sharing your time with us.
On our next episode, we talk health and wellness and how to look and feel good.
So if you have questions about this topic, email them at talktodoc@medicalcity.com.ph. I'm Dr. Oyi Balburias.
And I'm Maricel Lacsa Pangilinan. Remember, don't be afraid to ask because we can
Talk to Doc.
Your doctor has seen many different patients, but none exactly like you. You are unique. The more your doctor knows you, the better he can help. And the more you know about your condition, the better decisions you can make. So tell your story, ask questions, talk to doc.
Your health depends on you and me.
A message of concern from the Medical City.